New study out of Northwestern Medicine finds critically injured patients are not being transferred to trauma centers quickly enough when needed, and that's leading to preventable deaths. Researchers examined the process of transferring patients out of small non-trauma hospitals and found a lack of an efficient and effective system in the state of Illinois is leading to significant delays, and it's costing lives. Joining us now to dig into this research is Dr. Stey, senior author of the study and assistant professor of surgery at Northwestern University School of Medicine. Dr. Stey, thank you for joining us.
My pleasure. Thank you, Audrina.
Can you first tell us how the study came about? What did you observe, and what was the concern that you uncovered here?
So experiencing in 3 different states where I've practiced how hard it can be to get a patient who's seriously injured to higher level of care really motivated this study. And as a clinician, there's nothing more uncomfortable than knowing that you can't help somebody, and especially when we go into this business to help people.
And what did you uncover that made you say we need to look into this further and figure out what's happening here?
So we built on research that was already existing, that was nationwide, that you put up on the screen, which demonstrates that 17 to 34% of seriously injured patients are taken to hospitals that don't specialize in trauma care. And about 30 to 50% of those will never get transferred to higher level of care. And so we really wanted to know why. So the first thing that we did 5 years ago was start talking to the non-trauma centers and the low-level trauma centers to find out what was happening there. And what we heard from them is that they had a really hard time finding and accepting high-level trauma center with open staffed hospital beds. And so we just recently completed and published this second study, which demonstrates how at high-level trauma centers, the delays that we experience when we're trying to bring patients in the door is that it's extremely difficult to physically move the patient from one hospital to another, and also to move their data. So all their test results, their imaging results, all the different things that they underwent and had done at that previous hospital, it can be really hard for us to get those data.
I know you've already started to lay out some solutions in the study. Before we get to that, what stood out to you most in all of this research that you did, especially when it relates to preventable deaths here? We're talking about people's family who are dying, and it's preventable.
Yeah, I think one of the most surprising things to me in the study was really how, because we're working between systems, between hospitals and sometimes between health systems, there's no one single person or process or organization that oversees this movement of patients from the small non-trauma and low-level trauma centers to the high-level trauma centers. And so that's really why we see this breakdown, and in the process that's leading to these preventable deaths.
And in your study, you lay out some solutions, and one is something that was used during the height of the COVID-19 pandemic. What is it, and how do you think that can help in this situation?
Right. So the Illinois Department of Public Health does mandate all hospitals to submit how many staffed open beds they have every single day. And so every hospital in the state submits that. And the Chicago Department of Public Health recently had an initiative where they actually found a way to update those data on a near real-time basis by creating what's called an application programming interface, or a mechanism where the data from electronic health records in the hospital can get put into these bed trackers. And that was really in response to a lot of the hospitals feeling like the data in those bed trackers were not updated enough, because the patients that are coming through our ED and that are coming through our hospital, there's so much turnover. It's so fast. And so the moment you finish counting patients, there's another number, right? You have to restart counting. And so that's a potential solution that the Chicago Department of Public Health has been leveraging, and that has a lot of promise and has been used in other states. In other states, there have also been transfer centers that have been statewide. And a lot of this was actually started during COVID for the reasons that you identified. There was a shortage of critical care beds for people who were really critically ill with COVID. And so all the hospitals in the entire state came together with the Department of Public Health to create and support a transfer center where there's one phone number that every hospital will call if they need to transfer a patient to higher level of care. And then that transfer center occupies themselves with finding the best and closest high-level trauma center or higher level of care hospital to provide life-saving care to patients. And so that's another really really promising solution, again, that's already been done in other states.
All right, Dr. Stey, Assistant Professor of Surgery at Northwestern University's School of Medicine, thank you so much for the research that you're doing when it comes to trying to save more lives, and thank you for joining us here on the show.
My pleasure. Thank you.